Well, hey guys, welcome back to the Friday Q&A. So, as you can tell from the title and thumbnail of today's video, I'm going to be talking about a skin condition that I get many questions on, and that is dermatosis, papulosa, nigra, or DPNs. If you're not familiar with DPNs, I will attempt to insert a photo here of what they typically look like. These are small brown to black soft little spots that can occur frequently around the cheekbones, around the eyes, in certain areas of the face. They also can sometimes occur on the neck and the back and the body as well. They're more common and more bothersome to people when they present on the face, which more often than not is the case. These are not moles, by the way. I hear people refer to them as moles all the time. They're not true moles. In fact, they are benign little skin growths that just occur on the top layer of the skin. They're actually very similar to another skin condition that many people have on their body, different areas, called seborrheic keratosis. And I've done a prior Q&A on seborrheic keratoses, but dermatosis, papulosa, nigra, or DPNs are very, very similar to seborrheic keratoses. In fact, they're almost identical skin conditions. They just present a little bit differently, and that DPNs are these little smaller bumps that, for whatever reason, have a tendency to crop up on the face. For whatever reason, DPNs occur most frequently in Black people and African Americans, Afro-Caribbeans, people with black skin tend to be the ones who are affected by this condition. And sometimes people of Asian ethnicities can also be affected as well. Occurs very, very uncommonly in Caucasian skin types, however. We don't understand why that is. It also tends to be more prominent in women rather than men, although I'm sure all of you are familiar with a man's face who has these little spots. His name is Morgan Freeman, and so he is frequently referred to when we're talking about DPNs. We'll often refer to Morgan Freeman because he is very common in the public eye. But what are they and why do they occur? They, like I said, they're just little skin growths on the top layer of the skin. Good news, they are completely benign little skin growths. They're not cancerous. They do not turn into skin cancers. And they are not associated with any internal medical problem whatsoever. They're not associated with any underlying health issue. We really, unfortunately, have no idea why they occur or what is responsible for triggering these spots. I really wish we did, because then we could design better treatments to get rid of them. But the good news is that indeed they are not dangerous to your health. Now, while DPNs are not dangerous to your health, they don't go away on their own. They don't spontaneously regress, and there's really nothing that you can do yourself to get rid of them. And there's no treatment that can be done on them that will prevent you from getting more. That is one of the really unfortunate things about this condition. I think one of the things that is so hard to cope with if you're dealing with them is the fact that there's really nothing that you can do to prevent getting more of them. There is no pill or treatment or cream that will erase all of them or will prevent you from getting more of them. I think that is very frustrating to hear, but unfortunately it is the reality of DPNs. For whatever reason, they tend to first appear sometimes shortly after puberty, maybe 1 or 2, and unfortunately, oftentimes individuals who have them can start getting more of them with time as they get older. Not only can you get more of them, but the ones that you have can get bigger. So the treatments that you might seek out can get rid of the ones that you currently have, but will not prevent you from getting more of them down the road. And so it's very important that you be aware of that and cognizant of that when you go about seeking treatment and investing in the cost of treatment to get rid of them. There's nothing that you can do yourself to get rid of them. There are all of these remedies online that I would just caution you to ignore, all right? Burning them off with apple cider vinegar or, I don't know, gasoline, no. That more often than not results in post-inflammatory hyperpigmentation, and can also scar you. So don't attempt to remove these on your own. You know, it never, in my experience, it never goes well. Maybe that's because people who are successful don't ever end up going to the dermatologist to show me their success. There is not a peel that you can do. There is not a mask. There is not even a prescription cream that you can use to get rid of the spots that you have or to prevent more from coming. You may ask me, well, you know, tretinoin you mentioned has been helpful in reducing the number of milia that people get. Can this help DPNs? No, unfortunately not. So I wish there were a cream or something that we could come up with that would prevent these from occurring, but because we don't understand why people get them, it's really hard to design a logical cream. So currently the treatments that are available are largely going to be procedural based. In fact, all of them are procedural based. So the first step, you know, once you're interested in seeking treatment, is to find a dermatologist who can perform this. You know, dermatologists are very skilled in doing the procedures that remove these. They're very simple procedures. They're simple to perform, but you have to be cognizant of the fact that there are some risks associated with them. Because DPNs occur most commonly in Black people, people with darker skin types, the risk of these procedures is that you can actually be left with a pigment change there where the DPN was removed. It can either be a hyperpigmented or you know, a dark spot, post-inflammatory hyperpigmentation, which sometimes can slowly fade with time, or unfortunately it can be a light spot, post-inflammatory hypopigmentation, which may be tougher to fade with time, maybe more persistent, maybe persistent. And worst case scenario, you can also get a scar from the treatment as well, particularly if not done properly. So that is, again, why I caution you not to go DIYing this yourself. The last thing you want is to attempt to do this yourself and wind up with mottled hyperpigmentation and scarring as a result of some sort of internet hack. Depending on how many that you have, the procedures that are done to remove them may not be able to get rid of all of them. Some people have tons and tons and tons of them, and it's just not feasible to remove every single one. Or, you know, if you are really motivated to attempt to remove every single one, it's going to require multiple visits. It may be difficult to do in the time constraints of a single office visit. But the types of procedures that are performed are things like a simple snip excision. Sometimes the little DPN is soft and kind of on a little stalk or pedunculated, in which case a little tiny prick of numbing medicine may be put under the skin, or you may not even need numbing medicine. You know, we can come in with what's called a Gradle scissors. It's a special type of little sterile instrument that is used to just snip off the little spot. And then another type of procedure that can be done is to just shave the spot off flat. No, you cannot take a razor and shave it yourself. This is a surgical procedure, and so, you know, no, this is not something that you can do at home with your own Bic razor. Sometimes the spots can be frozen with liquid nitrogen, either a little tiny spray of liquid nitrogen, or you can, the dermatologist, you know, we can dip a Q-tip into the liquid nitrogen and touch it on there and freeze it off. And this kind of freezes the skin cells there, those skin cells that are responsible for the DPN. It freezes them and they die, and then the spot falls off, and hopefully, you know, you don't get another one there later on down the road. But that is how that is done. Another similar procedure is something called electrodesiccation, with that little zappy tool that you will see in your derm's office, and I've talked about on here before. That is another thing that can be done. And then there is microdermabrasion. Sometimes can be helpful in kind of smoothing them out a little bit and sanding them flat. Doesn't really completely get rid of them though, oftentimes. Sometimes it's successful. And then lastly, there are some lasers that can be useful for getting rid of these, resurfacing lasers. That intervention tends to be a little bit more costly, however, and you know, the outcome is oftentimes the same. Which treatment is advised for you is going to depend on a number of factors. You, like what are your expectations going in? Do you want to get rid of these completely, or are you okay with, say, reducing the number of them? Say you've got thousands of them. Would you feel better reducing the number of them by 50%, 60%? So those are kind of things to at least think about before going and have a solid idea so that you can verbalize what it is that you want to get out of the treatment. The procedures themselves, though, are very common in dermatology. Any dermatologist can do these comfortably. It's part of our training early on. We do thousands of things like this. It's very straightforward. As far as which one is selected and you're advised on, it's going to depend on how many you have and your skin type, which ones may be better suited as far as risk of hyperpigmentation, hypopigmentation. Depends on the area, the size, a few of those little subtle factors in terms of selecting which procedure would be best for you. So it's kind of hard to say like which one is best at getting rid of them. They're all kind of similar, but some are better suited to different individuals and different kind of concerns and backgrounds. Now, because this is not a medical problem, it is a, quote, cosmetic problem, although I do not at all underestimate the impact that this has on your emotional well-being and overall sense of self, having these lesions. Unfortunately, insurance is not going to cover these procedures and you're going to have to pay out of pocket. So go in knowing how much you want to spend as well, and kind of say that up front. That will also help kind of guide what treatments are selected and kind of set your expectations going forward. I think if you're going to make this kind of investment in getting rid of existing spots, knowing that you can still get spots down the road, you kind of have to do some soul searching and think about, all right, A, how much do these bother me? B, what is it about them that is bothering me? Is it just the sheer number of them, or is it like, of the 10 that I have, is it these bigger, darker ones that I want to get rid of? So kind of start soul searching and thinking about what it is that you want, determine your budget, and then understand the fact that, I don't know, maybe in 1 or 2 years, you're going to start to get more of them again, and you may need to reinvest and do whatever procedure it is that you're pursuing or pursued again, because nothing is going to prevent you from getting more of them, unfortunately, and nothing, it's very unlikely that if you've got tons and tons of them, that any one procedure is really going to be able to, wipe the slate clean. It depends on the number that you have, but just kind of understand that going in as far as thinking about investing in this type of treatment where it's not necessarily going to cure you of ever getting DPNs again. But I don't underestimate the impact that this has on your overall emotional health. I've seen people who will wear big sunglasses because they have a lot of them around their eyes, and they won't take their sunglasses off in movie theaters and dark rooms because they just are so bothered by the appearance of it. And makeup is not going to cover them just based on the way that they're shaped and raised. They're really impossible to camouflage in any way. Really are a pain for you, the sufferer, in many regards. So take some comfort in the fact that these are not dangerous to your health. Acutely, they're not related to any cancer or medical illness. But unfortunately, I really wish I could get on here and tell you some cheerful thing about, oh yeah, this is going to go away. But that would be a lie. So this is the reality, and sometimes understanding the reality can help you begin to come up with what's going to work best for you down the road. So I hope this video was helpful to you guys. Thank you for your suggestions as far as skin condition topics that you want addressed on here. There are so many skin diseases in dermatology, and I appreciate you guys commenting on things that you've battled with and would like to hear some more information on. That is always welcome. So thank you guys for suggesting this topic, and I hope that it was helpful. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.